People of St. Martin, both at home and abroad, I hereby address you as Prime Minister and Chair of EOC in an update for today, Saturday, March 28, 2020. Today, on Saturday, March 28, 2020, I held a meeting with the members and stakeholders of ESF 6, which was led by Public Health. In this meeting, representatives of the St. Martin Medical Center, the Ambulance Department, and General Practitioner, GPs, were present. ESF 6 Coordinator, Acting Secretary General, and Head of Public Health, Ms. Fenna Arnell, as well as Collective Preventive Services, were present. Fruitful discussions were held with the stakeholders aimed at enhancing communication, cooperation, and collaboration, seeing our limited capacity and resources. We were able to conclude very important decision points on the way forward in an effort to ensure that safety and security of our treasured medical health professionals as they fight on the front line of this COVID-19 worldwide crisis is assured. One of the decisions taken is streamlining the protocols between stakeholders based on the increased number of COVID-19 positive cases. The increased cooperation and sharing of information between CPS, the ambulance service, and GPs to facilitate when calls are made. In order to increase access to information to the general public, as well as offer additional support, a list with contact numbers of the GPs and their availability to serve the non-emergency public will be published to further alleviate challenges being experienced right now at the emergency room, which has lately been inundated with calls, inquiries, and visits of a non-emergency nature. The ambulance department will start as of Monday with an awareness campaign aimed at educating the public as to what exactly constitutes an emergency requiring emergency medical assistance to come to your home. This is in order to avoid unnecessary non-emergency call-outs which lead to resources being used in these events that are quite scarce, such as PPEs. These PPEs are actually quite necessary when our personnel, the ambulance personnel that is, has to make actual COVID-19 calls to assess and/or transport patients. We are, therefore, once again, making a call to retired nurses, licensed practical nurses, and other student nurses who are currently not in the field, as well as persons who are willing and able to assist the Mental Health Foundation, St. Martin Medical Center, White and Yellow Cross, as well as CPS. This has already been put forward by these institutions, and I encourage all persons to volunteer their time to be able to assist in these much needed areas. I can further update you that the St. Martin Medical Center has established an outbreak management team which meets daily to prepare for any further outbreak. These daily meetings are established to assess where they are presently and what further measures need to be taken in the near future as the situation unfolds. As a result, SMMC has ensured that they have 6 spaces for COVID-19 positive as well as suspected cases inside the hospital and have scaled down regular practices and activities in order to be able to free up beds in case an outbreak occurs. In addition to these spaces, the St. Martin Medical Center has, as of today, Saturday, March 28th, also received 4 emergency holding rooms for suspected COVID-19 cases. This is to alleviate pressure also on the emergency rooms and avoid contamination in that area where general cases can still be assisted. I hereby also update you as follows about St. Martin's current COVID-19 cases as per Saturday, March 28, 2020. As received from CPS just a few moments ago, returning residents are in self-quarantine now number 421. Self-isolated persons showing symptoms are 119. The number of persons tested are 41. The number positive are 6, 2 of which are currently hospitalized. The number negative is now 19, and the pending ones still awaiting the positive or negative results are 16. One of these suspected cases is currently also hospitalized. That brings our number of hospitalized cases to 3. But as I mentioned earlier, all but 1 case had recent travel or are contacts of a confirmed case. 2 are hospitalized and in stable condition. And as of last night, as I mentioned earlier, another suspected case has been hospitalized with flu-like symptoms and has been tested. We are still awaiting that result, as well as 15 others. As a result of this, even though there is but 1 case that is not related to travel, I still would like to implore all persons to stay at home. This virus must be taken seriously. As a result, GPs and other medical professionals will also be making that call to you if you have symptoms or if you have traveled to remain at home in isolation, that means in a room by yourself, or quarantined. If you are quarantined and therefore moving around in your home, your family members are also now suspected and should remain in the home with you. Arrangements should be made with other family members outside the home or close friends to be able to deliver food, medication, and carry out other essential services. You are asked not to visit the government building, GEBE, TELEM, the banks, and other essential areas, and especially not St. Martin Medical Center, the White and Yellow Cross where our seniors are, and other vulnerable persons. This is in order to protect the community. You are not being jailed, but trust me, if persons continue to break their quarantine and isolation, we are finalizing arrangements to have quarantine locations whereby you will then be forced into quarantine. This will not be a fun activity for you nor us, and will take away necessary resources that are needed to actually fight this disease. I am asking, I am imploring, I am begging you, stay at home. All around the world, this virus is taking phenomenal proportions, and we can mitigate the spread here by our behavior, by being proactive in monitoring ourselves, continuing to exercise good hygiene, and remain isolated or quarantined should you be a suspected case, have traveled, or are in the home with one of the 2. People of St. Martin, this is serious. Allow our medical health professionals to do their work. Give them the time and space to do so. Prank calls or unnecessary calls really does not help the situation. This is not a time to panic. This is a time to plan, prepare, and encourage others to be positive and uplift others. I've seen many opportunities where they have done mass parties, mass praying online. And I think these are the type of activities that build cohesion in a community that is now forced to live apart. We are a warm community, and soon we will be able to enjoy the hugs, the handshakes, and the kisses. But really at this time, stay at home, be safe, and until the next update, I bid you farewell for this evening.